Hypertension. High blood pressure. Silent killer alert. Understanding hypertension and taking control of your health. Join me as we dive into the world of high blood pressure, exploring its causes, symptoms, and effects on our bodies. Let's uncover the truth about silent killer and discover practical ways to manage and prevent it. From lifestyle changes to medical interventions, we'll cover it all. So, let's get started on this journey to better health and wellness. Hypertension, the silent threat. High blood pressure is a major risk factor for heart disease, stroke, and kidney disease. It affects millions worldwide, often without symptoms, earning it the nickname, silent killer. But with knowledge and action, we can take charge of our blood pressure and our health. Stay tuned for this in-depth look at hypertension, and let's work together towards a healthier future. Introduction. 1. Hypertension, also called high blood pressure, is one of the most common health problems worldwide. It affects millions of people and is a leading cause of heart disease, stroke, and kidney problems globally. 2. It is often called the silent killer, because most people do not feel symptoms until damage is already done. High blood pressure can quietly damage blood vessels and organs over many years without noticeable signs. 3. It is a major risk factor for stroke, heart attack, kidney failure, and sudden death. Uncontrolled hypertension increases the likelihood of serious, life-threatening complications affecting vital organs. 4. In Ghana and Africa, hypertension is on the rise due to lifestyle changes, stress, and poor health habits. Urbanization, unhealthy diets, reduced physical activity, and increased stress contribute to the growing prevalence of high blood pressure. Hosea 4:6, My people are destroyed for lack of knowledge. Many suffer preventable complications because they are unaware of hypertension, highlighting the importance of education. We share this today so that God's people can have knowledge and take action for good health. Awareness and understanding empower individuals to adopt healthy habits, seek medical care, and prevent complications. Blood pressure. 1. Blood pressure (BP) is the force of blood pushing against the walls of your arteries as the heart pumps. This pressure is essential because it helps deliver oxygen and nutrients to organs and tissues throughout the body. 2. It has two readings. These readings show how hard your heart is working and how much resistance the blood meets in the arteries. 1. Systolic top number. Pressure when the heart beats. This is the maximum pressure in your arteries when the heart contracts to pump blood out. 2. Diastolic bottom number. Pressure when the heart rests. This is the minimum pressure in your arteries when the heart relaxes between beats and fills with blood. 5. Normal BP, less than 120/80ths of a millimeter of mercury. This indicates that your heart and blood vessels are working efficiently without extra strain. 6. Hypertension, when BP is 140/90ths of a millimeter of mercury or higher on repeated checks. This means your heart is working too hard to pump blood, which can increase the risk of heart disease, stroke, and other complications if not controlled. Causes and risk factors. Some causes of high blood pressure can be controlled through lifestyle changes, while others cannot be changed but should still be monitored carefully. Uncontrollable factors. These are risk factors you cannot change, but knowing them helps you take preventive measures early. 1. Family history. Genetics. If close family members have high blood pressure, your risk is higher because it can run in families. 2. Age. Risk increases as we grow older. As you age, your blood vessels lose flexibility, making it easier for blood pressure to rise. 3. Race. Africans are more prone to hypertension. Certain ethnic groups, such as people of African descent, have a higher risk due to genetic and lifestyle factors. Controllable factors. These are lifestyle choices and habits that you can change to reduce your risk of developing high blood pressure. 1. Eating too much salt and unhealthy food. High salt intake causes the body to retain water, increasing the volume of blood and raising blood pressure. 2. Being overweight or obese. Excess body weight makes the heart work harder to pump blood, leading to increased pressure in the arteries. 3. Lack of exercise. Physical inactivity can lead to weight gain and a weaker heart, both of which increase blood pressure. 4. Smoke and alcohol use. Smoking damages blood vessels, and excessive alcohol raises blood pressure and damages the heart. 5. Stress and anxiety. Chronic stress can cause temporary spikes in blood pressure and lead to unhealthy coping habits like overeating or drinking. 6. Poor sleep, e.g., sleep apnea. Poor quality sleep puts stress on the cardiovascular system, leading to higher blood pressure over time. 1 Corinthians 6:19-20, Your body is the temple of the Holy Spirit. Honor God with your body. The verse reminds us to take care of our bodies by making healthy choices and avoiding harmful habits. Symptoms. Often silent. Most people with hypertension do not feel sick. High blood pressure is often called a silent killer, because it usually causes no noticeable symptoms until it becomes severe. When blood pressure is very high, some people may experience the following symptoms. These signs often appear only when the condition is advanced or dangerously elevated, indicating the need for immediate medical attention. 1. Headache. A persistent or severe headache can occur due to increased pressure in the blood vessels of the brain. 2. Dizziness. Blood pressure can affect blood flow to the brain, causing feelings of lightheadedness or imbalance. 3. Blurred vision. Raised blood pressure can damage the small blood vessels in the eyes, leading to vision problems. 4. Chest pain. Increased pressure can strain the heart, causing discomfort or pain in the chest area. 5. Shortness of breath. The heart may struggle to pump blood effectively, leading to difficulty in breathing, especially during activity. 6. Nosebleeds. Very high blood pressure can weaken or burst small blood vessels in the nose, result in bleeding. This is why regular blood pressure checkups are very important. Regular monitoring helps detect hypertension early and prevents serious complications like heart disease, stroke, or kidney damage. Complications if uncontrolled. Long-term uncontrolled hypertension damages vital organs. Persistent high blood pressure puts continuous strain on the body, leading to serious and sometimes life-threatening complications. 1. Brain, stroke, memory loss. High pressure can damage or block blood vessels in the brain, causing a stroke, and reduced blood flow can impair memory and cognitive function. 2. Heart failure, heart attack, enlarged heart. The heart works harder to pump against increased pressure, which can weaken it over time, leading to heart failure, heart attacks, or an enlarged heart cardiomegaly. 3. Kidneys, kidney failure, dialysis. High blood pressure damages the blood vessels in the kidneys, reducing their ability to filter waste, which may result in kidney failure requiring dialysis. 4. Eyes, blindness. Damage to the tiny blood vessels in the eyes, hypertensive retinopathy, can lead to vision problems or permanent blindness. 5. Blood vessels, hardening and narrowing. Atherosclerosis. Constant high pressure causes arteries to stiffen and narrow, increasing the risk of heart disease, stroke, and peripheral artery disease. John 10:10, The thief comes only to steal and kill and destroy. I have come that they may have life, and have it more abundantly. Good health is part of God's abundant life, and managing blood pressure is a key step in living a long, healthy, and fulfilling life. Prevention and lifestyle management. Hypertension can often be prevented or controlled by healthy living. Making consistent lifestyle changes helps lower blood pressure naturally and reduces the need for medication in many cases. Diet. What you eat plays a major role in blood pressure control and overall cardiovascular health. 1. Reduce salt intake. Too much salt causes the body to retain water, which increases blood volume and raises blood pressure. 2. Eat more fruits, vegetables, and whole grains. These foods provide essential nutrients like potassium, fiber, and antioxidants that help regulate blood pressure. 3. Limit fatty, fried foods and sugary drinks. Unhealthy fats and excess sugar contribute to weight gain, clogged arteries, and increased blood pressure. 4. Drink plenty of water. Hydrated supports healthy blood circulation and helps the heart function efficiently. Exercise. Regular physical activity strengthens the heart and improves blood vessel function, making it easier to maintain healthy blood pressure. At least 30 minutes of moderate activity, e.g., brisk walking, dancing, cycling, 5 days a week. Consistent move improves circulation, lowers stress, and helps control weight, all of which reduce hypertension risk. Weight. Keeping a healthy body weight reduces strain on the heart and arteries, lowering blood pressure levels. Maintain a healthy weight. Even small weight loss can significantly reduce blood pressure and improve heart health. Stress management. Chronic stress increases blood pressure, so learning how to manage it helps protect your cardiovascular system. Pray, meditate, and practice relaxation. These activities calm the mind, reduce stress hormones, and promote a healthier heart. Avoid unnecessary stress and quarrels. Managing conflicts and creating a peaceful environment prevents frequent blood pressure spikes. Avoid harmful habits. Eliminating damaging behaviors supports heart health and improves blood pressure control. 1. Stop smoking. Smoking damages blood vessels and raises blood pressure immediately after each cigarette. 2. Reduce or avoid alcohol. Excessive alcohol intake raises blood pressure and damages the heart and liver over time. 17. Proverbs 17:22, a cheerful heart is good medicine, but a crushed spirit dries up the bones. Good emotional health supports good physical health, and a positive outlook contributes to a healthy body and lower blood pressure. Treatment. 1. Some people may need lifestyle changes only. For those with mild hypertension or at risk of developing high blood pressure, healthy habits like diet, exercise, and stress control may be enough to keep BP within a normal range. 2. Many people will require daily medication to control BP. If lifestyle changes are not sufficient, doctors may prescribe antihypertensive medicines to lower and maintain blood pressure safely. 3. Medicines must be taken regularly as prescribed, not only when you feel unwell. Blood pressure medicine works best when taken consistently. Stopping suddenly or skipping doses can cause BP to rise again, increasing the risk of complications. 4. Regular blood pressure checks are essential, at least once a month if hypertensive. Monitoring your blood pressure helps track how well treatment is working and allows adjustments if needed to prevent long-term damage. Spiritual and practical integration. 1. God wants us to live long and healthy to serve Him, Psalm 91:16. God's plan for us includes a full and purposeful life, and maintaining our health enables us to fulfill our calling and serve others effectively. 2. Faith and prayer are important, but faith without works is dead, James 2:26. While trusting God is vital, we must also take action by following healthy habits and seeking medical help when necessary. 3. Therefore, we must combine prayer with medical care and healthy living. True stewardship of our bodies involves using both spiritual disciplines and practical steps, such as regular checkups, proper diet, exercise, and medication if needed. Practical tips for the church. 1. Organize free BP screening at church regularly. Regular blood pressure checks during church events help detect hypertension early, especially in members who may not visit the hospital often. 2. Encourage members to check BP at the pharmacy or hospital. Frequent monitoring allows individuals to track their blood pressure and seek medical help before complications arise. 3. Teach families to cook with less salt and more vegetables. Healthy cooking habits reduce the risk of high blood pressure and improve overall nutrition for the entire family. 4. Promote exercise activities, church walks, aerobics, etc. Group activities make exercise enjoyable and help members stay active, strengthening the heart and lowering blood pressure. 5. Support members who are on medication, reminders, encouragement. Providing emotional support and reminders helps members stay consistent with their treatment, improving their health outcomes. Conclusion. 1. Hypertension is a silent killer but can be prevented and controlled. Even though it often shows no symptoms, early detection and proper management can prevent serious health complications and save lives. 2. Healthy habits, regular checkups, and obedience to treatment can save lives. Consistently following a healthy lifestyle, monitoring blood pressure, and taking prescribed medication as directed are key to controlling hypertension. 3. As Christians, caring for our bodies is part of honoring God. Maintaining good health allows us to serve God faithfully and fulfill our purpose, showing gratitude for the life and body He has given us. 3 John 1:2 Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. God's desire is for us to be healthy in body and spirit, and taking care of our physical well-being aligns with His will for our lives. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.